In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold.
On March 11, 2020, the World Health Organization assessed that coronavirus outbreaks are already happening in the different parts of the world. In the last part of 2019, there are several reports of unknown pulmonary disease coming from China.
Domestic air and domestic sea travel to and from Metro Manila shall be suspended beginning March
And
15,
little did we know,
2020 and to end on April
it was the start
14,
of a pandemic.
2020.
Pandemic, a word that has left the world scarred, not until the vaccines came to shed some light of hope.
According to the Department of Health, the Philippines is again deemed high risk for COVID-19 as the number of cases climbs anew. The last time the Philippines was placed under high-risk case classification was from August to October 2021 when the country was experiencing a spike in cases due to the highly transmissible Delta variant. The World Health Organization set a 5% positivity rate benchmark for entering the new normal. This, however, should be maintained for at least 2 weeks for governments to consider reopening. The spike in cases comes as the Philippines recorded a total of 14 cases of the Omicron variant. Experts have said that the Omicron is the most transmissible coronavirus variant so far. COVID-19 vaccinations for people aged 5 and up are now readily available. All COVID-19 vaccinations currently licensed or permitted are safe and effective and reduce the risk of serious illness. Equitable access to safe and effective vaccines is vital to stopping the COVID-19 pandemic, so seeing so many vaccines proving and heading into development is quite encouraging. COVID-19 vaccinations offer excellent protection from major illness, hospitalization, and death. There's also some evidence that getting vaccinated makes it less likely that you'll spread the virus to others, so your decision to receive the vaccine protects those around you. While vaccine supplies are limited, the WHO recommends that those who are most at risk of COVID-19 get vaccinated first.
This includes people who are more prone to develop severe disease if infected, the elderly, and those with pre-existing medical issues, as well as those who are more likely to be exposed to the virus, such as health workers. Vaccination is a simple, safe, and effective way of protecting yourself against harmful diseases before you come into contact with them. Pregnant women are at a higher risk of serious illness and preterm birth if they are infected with COVID-19, so the WHO recommends that they be prioritized for vaccination after the first priority groups have been vaccinated. It strengthens your immune system by utilizing your body's own defenses to create resistance to specific pathogens.
Base sa survey ng SWS noong April 28 hanggang May 2, sa 1,200 na respondents, 32% ang handang magpabakuna, 35% ang hindi pa sigurado kung magpapabakuna, at 33% ayaw talagang magpabakuna.
Vaccine hesitancy is often powered by fear, which is a powerful emotion due to the perception of vaccines influenced by the experience from the dengue controversy in the Philippines. DOH needs to lessen, if not eradicate, the fear by presenting evidence-based interventions that bring understandably localized information to Filipinos and drive positive health-seeking behavior. In response to the COVID-19 vaccination campaign of the Department of Health, the Health Promotion Unit conducted a series of strategic communication and demand generation for the COVID-19 vaccination campaign for government agencies and established the Res Vacuna program of DOH.
Res Vacuna, tara mag-Res Vacuna para bawas pangamba.
As of January 5, 2022, the Department of Health Res Vacuna Mission already administered total doses of 110,869,650. From the total number of total doses administered, 57,328,147 was the first dose, 51,094,534 was second dose, and the total number of who took the booster dose was 2,446,969. DOH Resbacuna Mission is steadily distributing the vaccines all over the Philippines with an average distribution of 101,703 doses daily in the last 7 days based on the Department of Health website.
Libre lang magpares bakuna. Magtanong sa inyong health center o tumawag sa DOH 1555 hotline.
Ang ilang ayaw magpabakuna kontra COVID noon, pumayag na ngayon.
Levels of COVID-19 restrictions in the Philippines. As of today, the whole country is still under Alert Level 2 that is effective up to January 15 of this year. In addition, officials have extended the prohibition on foreign nationals with recent travel histories to high-risk red list overseas until the 15th day of this month. The domestic measures officials continue to enforce COVID-19 related restrictions utilizing a multi-tiered alert level system which ranges from 1 to 5 in terms of rigor.
For Level 4, residents under the age of 18 or above the age of 65, as well as pregnant and immunocompromised persons are required to stay at home in all regions. However, there are certain exceptions. Fully vaccinated persons may attend meetings, incentives, conferences, and exhibits, MICE, public places, and events. Under Level 3, it is possible to travel both inside and between zones. MICE events, public places, and event venues may open or take place at 30 and 50% capacity for indoor and outdoor areas respectively for fully vaccinated persons. High-risk locations are also required to shut down. And under Level 2, travel inside and between zones is authorized. At 50 and 70% capacity for indoor and outdoor venues respectively, more companies, recreational venues, tourist attractions, and social gatherings may operate or take place for fully vaccinated persons.
About 100 public and 20 private schools in minimal risk COVID-19 areas are set to participate in the pilot limited face-to-face classes of Department of Education. The rest of basic education schools in the Philippines will continue with blended distance learning. The agency is finalizing the official list of participating schools but has already shortlisted possible participants from the initial of 1,900 that met the safety and facilities requirements.
Face-to-face classes in Metro Manila suspended as the National Capital Region reverts to Alert Level 3.
That's right. According to DepEd, face-to-face classes in NCR have been suspended as the region remains under Alert Level 3. This is in accordance to IATF guidelines. In-person classes will proceed in areas under Alert Levels 1 and 2. DepEd is finalizing its report and recommendation on the pilot study of face-to-face classes.
There is now consistent evidence that Omicron is spreading significantly faster than the Delta variant.
This 2022, we hope that life can finally begin to return to normal after almost 2 years of lockdowns and continuous outbreaks of epidemic. Due to the increasing worldwide vaccination rates as well as new developments of COVID vaccines, this year's vaccinations may become more widely used. The new normal may not be like the old normal, but it will be a new world with a transformed society. Despite the doom and gloom of the ongoing pandemic, light remains at the end of the road.